Welcome back and thanks for staying with us. According to the World Health Organization, every year 727,000 people take their own life, with 73% of global suicides occurring in low and middle income countries, and suicide being the third leading cause of death among 15 to 29-year-olds. Now, for every suicide, there are many more people who attempt suicide, with a prior suicide attempt remaining as the single most important risk factor for suicide in the general population. Now, World Suicide Prevention Day, or WSPD, was first observed on the 10th of September 2003, initiated by the International Association for Suicide Prevention, or IASP, in collaboration with WHO. Now, the day aims to raise awareness, promote advocacy, and reinforce a vital message: suicide is preventable. Now, joining us today is PREDNISON Morales, Mental Health and Psychosocial Support Coordinator for the International Federation of Red Cross and Red Crescent Societies, IFRC, in the Asia Pacific region. PREDNISON, thanks for doing this. You're a social worker with extensive experience in mental health and psychosocial support. You work closely with National Red Cross and Red Crescent Societies across Asia Pacific, and this month you're focusing particularly on suicide prevention and highlighting community-based interventions and emergency response effort as part of a month-long campaign for World Suicide Prevention Day. Thank you very, very much for your good work, and thank you for joining us from Hong Kong at this point. Now, from your experience, why is World Suicide Prevention Day so important, and what do you think the public needs to better understand about suicide and mental health? PREDNISON?
Thanks, Jared. So you're correct. Actually, every September 10, we are reminded of just how serious the issue of suicide is around the world. It's actually heartbreaking to know that every 43 seconds, someone loses their life to suicide. And it's especially affecting low and middle income countries, as well as young people aged 15 to 29 years old, where it's a third leading cause of death. These numbers are more than just statistics. They represent real people, real families, and the entire communities that are impacted by this crisis. We are doing this to call for an awareness that suicide is also a public health concern. Mental health challenges like depression, anxiety, and substance use are often behind of these cases. We need strong mental health systems, better access to care, and real support for those who are struggling. And while governments and humanitarian organizations play a big role, there is something we all need to care about. Everyone, communities, workplaces, schools has a part to play in making mental health support more accessible and less stigmatized. Actually, I heard like a very good news. Recent Malaysian governments moved to decriminalize suicide and encourage mental health care. It is a great example of how policy can make a difference. But we need more advocacy, more investment, and more compassion. In the Red Cross and Red Crescent movement, we're committed to mental health and psychosocial support, and we would like to ensure that our national societies are equipped with basic mental health and psychosocial skills to support people in need. Because at the end of the day, it's about making sure people know they're not alone and that help is always within their reach.
Right, and before I move on to my next question, I'd like to at this point also highlight to the viewer that earlier this month, or at the end of last month, we had a bunch of Malaysians who put together a beautiful event to raise awareness about suicide, and it was, of course, put together by someone who's passed on, who's taken her own life, Joey Gui. That movement has gone on to be something different, and it's morphing into something bigger. It's called Courage in the Current. Courage in the Current. You can go Google that and get more information about that, because they want to try to put that message out there about suicide too. Coming back to you, PREDNISON, evidence indicates this: emergencies and disasters often place immense psychological stress on individuals. Now, how do suicide risks change in crisis settings, and what kind of mental health support are most effective in these contexts? PREDNISON?
Yeah, actually, Jared, we all know that crisis and emergencies causing suffering and disruption of lives. But what often overlooked is that many communities, especially in the low and middle income countries, are already dealing with serious challenges long before a crisis hits. Poverty, access to services, and other economic issues make them even more vulnerable when disaster strikes. Actually, to add up, some of the research shows that suicide rates can rise 20% after a crisis. So when people lost their homes, livelihoods, or loved ones, the emotional toll can be overwhelming, especially in communities already facing hardship. One of example that really struck with me was the Zoot in Mongolia in March 2024. Actually, Zoot, also known as extreme cold weather or cold surge, was the worst in 100 years in Mongolia. Temperatures dropped to minus 30 degrees Celsius and snow covered 90% of the country. Millions of livestock died and many people lost their livelihoods. The impact was truly devastating. What was even more heartbreaking was hearing from our colleagues at the Mongolian Red Cross Society that suicide cases increased during that time. While we can't always pinpoint the exact cause, the stories from the community showed how deeply people were affected by the zoo. So in response, the IFRC Mongolian Red Cross launched an emergency appeal with strong focus on mental health and social support. So we trained staff and volunteers to provide emotional support, set up hotlines in provincial branches, visited children and youth in their boarding schools, and shared information on how people could access help. This is just one example. Across the region, our national societies are doing incredible work, supporting governments to set up hotlines, raising awareness to fight stigma around mental health, and training community volunteers and health workers to provide support when it's needed most.
Now, suicide and even mental health more broadly can still be difficult topics to talk about, especially in some cultures. Here in Asia, too, it's a big problem for us to talk about it. What are some of the practical ways that families and communities can help reduce the stigma around these issues?
Actually, nowadays, even in many countries in the region, there are still real challenges in how we talk about mental health. Sometimes terminologies like mental health and psychosocial support don't translate well into their local languages. In some places, they're immediately mental illness, which can lead to fear, stigma, or misunderstanding. There are so many myths and misconceptions that stop people from reaching out. So one common myth is that when we talk about suicide, people thought that we are making someone more likely to act on it. But in reality, having open and compassionate conversation can help someone feel heard, supported, and less alone. So families and communities can work together to break down this stigma. For example, we can start normalizing the conversation about mental health. We can also avoid labels by using respectful language. Instead of calling someone who are struggling that crazy or weak, we can empower them through different words. And we need to listen without judgment. People who are opening up, just be present. And if we want to do that, we should also open, or we should also model openness. For example, if you're a parent or you are a leader, for example, you can also talk about your own emotions or your stress, because it also shows other that it's okay to seek help.
Now, I've just got one last question to you. For anyone watching who may be feeling overwhelmed or hopeless right now, what message would you like to share with them, PREDNISON?
Seeking help is not a sign of weakness. It's a proactive step toward your healing. Speak to your family, your friends, and other people that you feel like can help you. Most especially our mental health professionals. They are trained to help you understand what you're experiencing and to support your recovery in a safe, confidential, and non-judgmental environment. And then reaching out to psychologists, psychiatrists, counselor, or social worker can be a critical step toward to your healing.
Now, we still have a bit of time to go, and I'd like to just move into this, if you indulge me. What signs should people look out for if they're worried someone might be struggling with suicidal thoughts, and what's the best way one can use as support, or how do we support them?
There are several signs that may indicate someone is at high risk of suicide. So some of the most common include changes in their behavior. For example, suddenly withdrawing from their friends, family, or the activities they used to enjoy. We can also observe some verbal cues. So maybe someone can express their hopelessness or guilt. And other signs also include giving away their personal belongings and saying goodbyes. Actually, there's a lot. Since it's not always easy to recognize these signs, I think it's important that we regularly check in on our family, friends, peers, and colleagues, especially when we know that they're going through difficult times. So maybe a simple asking like, how are they doing, can go a long way. We need to be more empathetic, kinder, acknowledging their worries and fears, and offering practical support. It can make difference.
Mm-hmm. I know we've put together questions based on what we want to talk about today, but personally, as someone who's worked in this area for a while and who's volunteered and who's seen a lot, what do you think is something we need to remember? Because we always believe that, you know, it will never happen to anyone in our family, and you know, before you know it, someone you know or someone close to you takes their own life. What would your personal message be to all of us, PREDNISON?
Yeah, just like what I mentioned earlier, I think if we feel that we need help, we need to seek help. And for the people around us, we can be that person. So we need to know how to become empathetic and how to understand somebody's struggle. So with that, I think that's the first step for them to receive help.
Right. So I guess what you're saying, if I'm hearing you right, if I'm listening right, empathy is very important. You need to be empathetic. I think if there's one place we can start, we need to understand what empathy is. All of us, the collective, being cold, not being receptive, not being sensitive to, you know, how people are feeling around you is one of our biggest problems. So empathy is a good way to start. Thank you very much, PREDNISON, for taking time off to join us. PREDNISON Morales joining us from Hong Kong, the Mental Health and Psychosocial Support Coordinator for IFRC Asia Pacific region. That's a wrap for this hour's broadcast. Don't forget to visit Bernama.com and follow us on our social media channels, YouTube, X, Instagram, and Facebook for the latest news. You can also receive updates from Bernama Radio. That's if you're driving in the Klang Valley at 93.9 FM. This has been The World on Bernama TV. I'm GERARD. Thanks for watching.